Oh.
God.
Oh my God.
Ah! What'd you say? Goddamn? Nice! You said something! Goddamn.
Oh my
Right
God,
knee?
that one hurts so bad. Ow! The happiest
3.
torture.
Oh my God.
I needed that.
I felt that.
Wow, I could.
Tell them.
Oh my God.
Tell them. They don't believe it's a real thing.
Oh my gosh. I have air going up my nostril.
Gotcha.
Oh my God.
That's it.
Like.
Something came out. Came up, right? Welcome to the office.
Hello.
Welcome back.
Thank you.
How you doing?
Great.
What's going on?
So.
It's been about a week and a
Yeah.
half.
Jaw's been great. I've been popping like minimal.
How's the pain?
Like not. Like it almost feels like I can't pop it fully, if that makes sense.
Open it fully?
Or like pop it.
You're trying to pop it?
Or like when I pop it, it's usually I can pop it really loud and it's like intense. This time it feels like there's something kind of like holding, like it feels like
It's holding in place.
Yeah.
Tailbone.
Tailbone, same. Yeah, I haven't noticed it as much, but I can still like if I sit on it a certain
if you
way.
sit on it a certain, but you
Yeah.
have to do something to notice it. It's
Yeah.
not just there.
Yeah, like if I sit like this, I'll notice it. But like if I'm sitting like this, I'm not gonna.
So if you put both your feet up, you feel it?
Yeah, like if I'm more leaning. Which
When
I
you're
kinda
leaning
do
back.
that. Mm-hmm.
Okay. All right. Okay.
Yeah.
And do you have anything new?
Oh yes. My foot, so I really can't even explain it. Like yesterday I was able to pop it like just by doing this and like that, but it like in here.
There's pain?
Yeah, like sharp. Like I
see.
can't even explain it.
This, like, if I follow it from here, okay, this is the navicular bone, and I'm going in.
Yeah.
Okay, go on your back for a second. Talus, tender. We still have to work there, because remember we said 85% of all foot issues get resolved with the talus, so we're going to continue on talus. Fibula, not so bad. Navicular, tender.
Oh yeah.
Cuboid, yes?
Yeah, not as bad, but yeah.
Okay, let's come off the third ray. Dropped second cuneiform, yes?
Yeah.
Okay. So, we have talus, we have cuboid, we have navicular, we have dropped second cuneiform, and we'll check the first as well.
Yeah. Like it almost feels like the navicular is just like constant though.
That one there, the orange.
Yeah.
Okay. We'll work on that at the end, okay? Alright, you ready to get started?
Yeah.
Let's do it. Up top, around 1, 2, 3, fourth chakra. What's the fourth chakra?
You always ask me.
Root, sacral, solar,
Wait.
heart.
Oh, okay.
The heart chakra. That's not the heart chakra nerve, but that's the heart chakra. Static palpation, starting at the base of the neck. Your swelling has come down quite a bit from day 1. 1, 2, 3, 4, 5, 6, 7, 6, 5, 6. We got 7 today. Now, tailbone pain-wise, so headaches are pretty much gone.
Yeah.
Jaw's doing better. Tailbone is still an issue. But is it there constantly, or you have to move positions to feel it?
Yeah, I like to move positions. Like standing up, it's non-existent. It's mostly just sitting down.
But before, when you were standing, it would be?
No, not really. Just mostly sitting down. But like it would be more prominent. Like in the car, I would just like.
How about now when you're driving over?
I didn't even notice it. It kind of depends. Like maybe if I'm driving a long time, it will. Oh.
Okay, 1, 2, 3, 4. 4 on the left, 4 on the right.
Oh, right.
Okay. 2, 3, 4 on the right. 5, not so bad. Coccyx to the right
Yeah.
or to the left.
Right.
Slowly open. There, but less.
Uh-huh.
Good. Slowly close. Nice. All right.
Yeah.
Nice. I like it. Good job.
Yeah.
Good job.
Good job.
Yeah. S1, S2, S3. We're gonna do Coccyx to 5, and then we're gonna do S4. We're gonna do Coccyx to 5 on the right side, so that's gonna be a left side down, and then we're gonna take 4 from the opposite side. After that, we're gonna go to T7. 1, 2, 3, 4, 5, 6, 7. 7, we're gonna take it as a PLS. And then we're going to check the neck after that. Okay. You ready?
Mm-hmm.
Left side down over here, please. I have to bring the coccyx from the bottom back up this way. Can you deal with it?
Yeah.
I'm holding firm. I got to bring it up. A little more. Let it go. Gotcha. Walk it out once, and then we're going to go right side down. Okay. S4. There you go. You okay there? S4. Let it roll.
Oh.
God.
Oh my God.
Stand on your back. Stand on your back.
Oh.
I'm going to push on the
Oh. The
navicular.
navicular.
Same or different?
Ah.
Same?
Yeah. Yes. Oh.
Okay, let's work it out. Walk on your toes towards me. Turn around, walk on your heels. Were you wearing a lot of high heels this past few weeks?
Not at all.
Not at all. Do you do high heels?
I mean, if I have to for work,
But generally no.
yeah, no, not in my
Cool.
personal life, unless they're like tiny.
Okay, good. Face down, T7. I hope you've been reading your comments. A lot of people sending out good vibes for you.
Oh, good.
Yeah, a lot of people sending out really good vibes. Slide up.
Okay, I saw that you posted the other one.
And they want to know about the job more than anything else.
Right? They're
And
obsessed.
but there's at least 100 plus people dealing with the same stuff you got going on.
Mm-hmm.
And they haven't got an answer. So 1 is the physical part, 2 is the spine, 3 is the stuff. T7.
Oh.
No, drop the shoulders.
Oh.
Oh, it's tight. Drop it down. Drop it.
Oh.
Gotcha.
Yeah.
5, 4, 3, 2.
But like, I tried going to the dentist, and like, she was like a specialist at TMJ, but like the thing kept, like, it was just this thing that I like had to, didn't
Appliance?
work. Yeah.
Was it a night
Couldn't
guard?
talk.
A night guard?
No, it was like all the time for like a month, which I guess is like, you know,
Did it work?
well, no.
Did it change
It kept
anything?
breaking and, no,
Okay.
yeah.
Any other things you tried? So just the
Not
dentist?
really. Yeah, just the dentist and you.
Got it. Well, good thing we figured out a lot of it.
Yeah.
Sit back for me,
Just
please.
go to him.
So,
Oh.
that's what's up. Okay, I'm gonna hold on the right side, open the jaw. Close. I'm gonna hold on the left so you can already feel it.
Ooh.
Okay. Let's do the occiput. Chin back. Occiput. PSLS. It's a lateral to medial, P to A, scooping motion. I just want to make sure we got it tucked. There you go. Just like that. Look up. Just like that. Good stuff.
There's less of a crack though.
What's that?
There's less of a crack.
Mhm.
Oh, nice.
It's holding better.
Oh yeah.
That's why.
I wonder if I don't even want to try it, but like I wonder if I cracked my neck
Please
how I
don't do
usually
that
did.
here. Please don't do
No,
that.
yeah, no, but like I won't.
All right, let's see how the spine did first. Starting at the base. Still a tiny bit there. I'm going to do it without the strap this time. There we go.
Oh my god.
A little less of a crack, huh? Sit up straight.
Oh my gosh.
A little less of a crack.
Ooh. Oh Lord.
I was trying the less is more, but it didn't work.
Yeah.
Now you're clear. Neck is clear. 7 is clear. You feel that now?
Not as bad.
Down low.
No, like not even at all.
I need you to ice here, okay?
Okay.
Cool. Alright, let's do the foot first. Go on your back here. Alright, so we're going to prep the ankle first. And we're going to work out the scar tissue and swelling as much as you can handle.
Okay.
So what I'm doing here, guys, is we added a little lotion. You can use lotion, BioFreeze, or any of those other products. You can use oil. And the idea here is we're working scar tissue and adhesions. You can do the bone comb too, or the gua sha. And I'm working what's called periarticular swelling, getting all that swelling out. You okay there?
Yeah.
I'm not going.
It's like it like tickles, but also.
It's like a tickle pain.
Yeah.
Alright. And then when we get to the medial aspect of the talus, that's where the adhesions are right there. And it's as much as you're going to handle, okay?
Okay.
If anything is too much, you tell me to slow down, okay?
Okay.
5. Don't fight though. Don't fight. 4, 3, 2, let it go. There it is. Second part of the prep for the talus. This is not just let's yank the talus. If it's a new injury, something that's been there, you know, very recent, doesn't need a lot of prep work. This is passive range of motion, and what I'm doing here is I'm dorsiflexing the foot and applying a to P pressure on the dome of the talus with the web contact of my hand. Okay, so we're going back and down. This is working the interarticular swelling. 4, 3, 2, 1. Okay, now it's ready for set. AS talus, medial tilt. It's tight. And let it go. It's a little bit. One more. We're going to have to use the board. Still not ready to pull. Lift it up. Let's see if I have that. Okay, we got to break out the big gun.
Oh man.
And I want you to hear this. So,
the
gua sha,
gua sha? Oh,
that's
yeah,
the
yeah.
gua sha, right? Listen. feel it?
Yeah.
You don't really hear it that much, but you
I
can feel it.
heard it at first. God. Oh, that's awful. Oof.
5, 4, 3, 2. Let's just see what this feels like. That's not so bad.
Yeah.
It's a little bit there,
Yeah.
but it's not that. It may bruise a little bit.
Is that like, what is that doing?
Those are adhesions. This is breaking up those adhesions.
Oh, from
So I
like
can't
sprains?
get it. Yeah.
Oh, wow.
Okay, let me try to set it one more time with a pull.
Okay.
If not, we'll do the drop. And I'm going to just change the angle a bit. Okay. And got to get a little more scoop.
Okay.
Oh, wow. Can you handle it?
Yeah.
Shasha! I need Shasha. Shasha! I need help. I have a difficult ankle today. Come on over. Can you hold her firm, please, sir? Oh, wow. Okay, right here. No, don't pull, just hold. That's it. Not yet. We'll get
Dang.
there. We ain't forcing more than that.
Yeah.
Slide up, please.
Okay.
All right.
One day.
Talus.
Oh. Did
Oh.
that just do it?
Oh.
Oh.
Ah.
Oh my God.
Oh. That feels so crazy.
Yeah, right? Ah.
It's like the whole thing's going.
Yeah, like the joint is like deformed.
There. No, it's a scar tissue.
Oh my
Ah. Got it.
God. That is odd.
Cuboid. I'm here on the cuboid, thenar contact using the board.
God, that's scar tissue?
That's
Like-
adhesions. So I'm trying to, let me show you what I'm trying to do. No, I'll bring the model.
Oh.
This is a right foot model. I don't have a left foot, but I can explain. So what I'm doing here, it's the left foot, but I'm demonstrating the right. So it's the medial talus, it's tilted like this. And there's adhesions inside here. So when I'm,
Like-
right there. yeah.
Oh, okay.
And so what I'm trying to do is, as I'm tractioning the joint, long axis distraction, not traction, distraction, it wasn't releasing. After we
Yeah.
just did the gua shed, now something is loosening up. So what we're
Oh.
feeling in there are those adhesions in the ligaments just trying to break up. It's almost there.
Wow. So it's like almost attached to the.
Well, the ligaments attach the bone, right? The function of a ligament is to attach bones together. But the adhesions, it's like little balls of connective
That's
tissue.
what it felt like knots almost. in your
Knots,
back.
there you go, there you
Yeah.
go. So they're, exactly, that's a better
Yeah.
way to explain it. It's like the knots in your back, those are the knots in your ankle.
Ooh, which
That's
is
a good way to
worse.
explain it. Is it?
Oh yeah, because it's like so small. Like in your back, it feels good, you know.
Feel this now. Not as bad. Okay, let's get the navicular. Now, what I'm doing with the speeder board is I'm doing all the Gonstead contacts that we learned using the speeder board to make it to go a little quicker. Right there.
Oh. Oh, sorry. Oh. Oh.
Beep, beep.
Oh.
3.
Oh my God, it
2.
hurts so bad. Oh, what is going on there? Ah.
There you go. One more. On your back, you can try one more. There you go. It's talus, navicular, and this whole first cuneiform.
Oh man.
Can you handle one more?
Yeah.
Turn to your side. Okay, we're going to do it without the board. Alright. And we're just going to do the contact straight into the some, look, it's loosening up.
Yeah.
Let's get a little more. You can handle it?
Yeah.
There you go.
It does feel like it's loosening.
Bunion I'll do next time, bunion protocol.
Okay.
That's too much on your foot there.
Oh my god, that is not good.
On your tummy. Okay. Oh, the fun's just starting.
Oh man.
Slide up. So when we're doing the, check this out. We're coming off the third ray to the second cuneiform. Second cuneiform is trapezoidal in shape. It drops down and it irritates on that plantar fascia. So to find it, you come off the third digit right here, and you follow it right there. Now, in order to set it, you really gotta splay or open up the midfoot with your fingers so you can set it through. Since I didn't do the board for that, I'm not going to use the board. I'm going to do it without the board. There you go.
Oh my god. Ugh. That foot is so messed up.
We'll get it, don't worry. There you go.
What even is a bunion?
Bunion is when you start to get that, starts to deviate, you were starting to develop it, so we're going to prevent it, okay? Stand up, please. Let's walk that off 3-4 times. As you're walking, you can tell us how that's feeling. It should be a little different. I know it's sore.
Yeah.
Let's watch your feet too. You can see the mechanics. Walk on your heels first. Walk on your toes. Walk on your toes. This should be a little different.
This almost feels like it's harder to walk on this foot with the heel. But this is fine.
Have a seat, and why don't you play with it like you were earlier and see.
Yeah, it's still there, but it's not as...
A little less, right?
Yeah.
Okay. And as we're working out that scar tissue, it'll get easier each time, okay?
Okay.
You got it. All right. Now let's get to the jaw. You're starting to say what you need to say now, right?
Yeah.
Feels better, doesn't it?
Mm-hmm.
Slowly open. Okay. Open all the way. I'm going to do a light EX on the right side, just a light one. You tell me to stop if I need to. That's it. That's it. Good. Good job. We're going to work on the left one now, okay?
Okay.
5, 4, 3, 2.
Oh.
Okay, let's do this. Let me get the condyle block. Open. Open. And close. You got it. You got it. You got it. There, that's it. There you go. You got it. Yeah. Okay. Open and close. Open and close. Slowly open. Open. You got it. There it is. You got it. Open. Is that as much as you can open? Okay. Is that it? Okay, good. Hold. I'm doing the left. Close. Feel all this stuff here.
Ooh. I don't like that.
Okay. More talking, okay?
Okay.
More talking. More saying what you need to say. And I'm glad you said you don't like it. You want me to not do it? I won't do it.
No, I mean,
It's not fun, I
whatever it
know.
takes, yeah.
But you got to go through it
mm-hmm.
if you want it. Okay. Relax.
Ooh, oh, I felt that one.
Right shoulder. Nope, let it go. Let me do the work. Let me do it. Drop. Drop. There.
Ooh.
Okay, let's buff it out. Let's buff it out. Squeeze. Elbow. Radial head. Relax there. Actually, we're going to do it this way. It's the thumb contact on the radial head. You want to supinate the arm as you extend, and it's that last bit of extension. It's just a light set. Okay? Relax the elbow, just like that.
Oof. Ooh. That hurts. Oh my gosh.
You want me to talk about scar tissue again?
Yeah, sure.
It's got scar tissue. Okay, that's it.
You know, I used to like pop it like that. Probably not. That's probably why.
Squeeze. Inside ulna, right there. I'm barely touching
I know,
it.
it just tickles.
Okay, relax there. Distal radius. Lunate. Seed the joint. Squeeze. Pleasure.
Thank you.
I'll see you next week.
Yes.
She don't really want to be here, so I mean, you brought her here for a reason, Dad. What's going on with her?
Yeah, the way she kind of walks, she says that the right leg bothers her when she's walking. I mean, you can kind of notice when she walks.
All right, here's what we're going to do. Let's go over your x-rays. Let me tell you what I see, what I find.
Sure.
This is L5, S1, S2, S3, S4, S5, and then we have the coccyx. There is a tailbone injury right here in the coccyx. There is a tailbone injury in the coccyx. She had some fall here. Whatever it is, I'm just pointing out what I see. I'm going to zoom in and show you more detail. So these are little remnant discs, okay, and they should be level and parallel. This one is open in the front. This one is level. This one is fine. This one is open in the back, okay? Now, this is S1 over here, and I want to talk about S1 on this x-ray, and I'll be jumping back and forth a few times. I want you to look at her hips. Her hips look different. Her hips are a little bit off balance. This left side is lower, this right side is higher. Do you see that? Yes?
Yes, sir.
The way it's developing is different too. Like this looks bigger generally, this looks smaller. Now, if we look over here, there is what's called, this isn't 10% of the population. It's a finding, and the finding is going to, when I touch it, it's going to hurt a little bit. It's right there. It's called spina bifida. And it's non-union of the lamina to form the process. She's 10 though. Things are still developing with her. Okay, but if I touch in there, it's probably going to hurt. And it's not the cause of anything. It's just there. It's a finding. And it's, as I said, in about 10% of the population. This is the sacrum. And what it looks like to me, I'm hoping this thing is going to fuse. It's looking, with the alignment the way it is, it's still developing. These are growth centers, okay? This all still needs to fuse. But what you can see is very different here versus here. Do you see that? So Dad, you did a great thing by bringing her all the way over here. Okay, jokes aside now. This would have developed malformed. Straight up. And if you look over here, these are the remnant TPs. Remember we were talking about transverse process. Those are your transverse processes of the S1 tubercle. And we want to make sure that it develops symmetrically. Right now you can see there's more space here than there is here. Yes? You see the line here, this lucency right here? So this needs to form the sacrum, the tailbone. Now, as we go up, there's a bend in the tailbone right here. The tailbone is bending. It's going like this and like this. And the left hip is lower than the right hip.
Yep, definitely.
Now, let's look at the numbers and see what the numbers tell us. We have an 11 millimeter measured deficiency. This needs to be under 7, dude. And it needs to be under 7. She's putting more weight on her left side. Okay, so she's probably swinging that right leg. She has a rotated sacrum on the right side that's dropped on the left. There was a trauma, there was a fall. Whatever it is, there was. She fell somewhere. So rotated sacrum on the right, dropped on the left. We have a rotated pelvis slightly. If we're choosing the right side, it's IN, the left side is EX. Let's put it together. So the right side, it goes in, the sacrum goes back. So her foundation wants to go to the right side, but her hip wants to bring her to the left. That's her imbalance. That's number 1. If we're trying to establish a curve, then the IN is what we're going to work on. Okay? IN will mimic an AS. There's no up and down misalignment. So the IN will mimic the AS. Now, if we have an IN on the side of a rotated sacrum, the book says to do the sacrum. Where we're going to start is going to depend on what I find on her. But I am going to have to work on this hip too while she's here. So we're going to need to work on sacrum and hip. Okay? So what I'm seeing here is this. There's definitely something going on right here. There's a side slip of T4 that's related to the neck. This is all compensation. Compensation, compensation, compensation. This is spina bifida. This is the transverse over here. It's almost 1, 2, 3, 4, 5. It's almost as if this is becoming a transitional vertebrae where it wants to take on the characteristic of L5. But if we can get this set right, you can see this is swollen. You see this pelvis here? You see it's a lot more swollen than this side. This left pelvis is swollen. You see that line through here, Dad? And the line here?
Yep.
Okay. So let's examine her and figure out where we're going to start today. Let's have you walk to the corner of the room and back, please. Go ahead and walk. I got it. Okay. And go ahead and walk for us. Keep walking, please. So the right leg is high, stuck, and she's kind of moving this way. And so she lifts that side up from that dropped leg. Your left leg is fine, right? Left leg has any pain? Both legs have pain?
For now, should have some pain from the other day when she kind of twisted the leg. Yep.
But before that twist, her left leg
Not
is
really.
because she plants it and then she swings the other leg.
Yep.
Okay, I got it. All right, come back over here, have a seat. Let's get started. Starting at the base, we're getting 20 points in the upper cervical, top left side. S5. 15 points down low. S5 coccyx. And up in the penthouse. Open and close. Open and close. Right side only. Right side only. Open and close. Open and close. Left side only. I mean, they're both. Does it hurt more on the right side? Yes? She don't speak though. Left side? She does speak though, right? She got a voice? Alright. Just making sure. More pain when I push there on the right or the left? Which one?
Gotta talk. Left or right?
Just raise your right hand or your left hand if you don't want to talk. Left hand, okay. Scoot back for me, please. She's a tough cookie, yo. Sit up straight. Alright, now, I told you spina bifida will hurt S1 regardless. It's not the cause, but it's going to hurt. But after I do my job, it should feel better. So let's come back slowly towards me. That's number 5. Does that hurt when I push there?
Does it hurt?
Little bit. This one hurts more. That's the bifida. Sit up straight, please. S2, S3, yes. Bear with me, I'm sorry. S4, yes. S5, that's where it started. I'm sorry.
That's good.
That's where it started. Let me give you some S5 on the left. I'm sorry. You can yell at me. S5 was the worst? Okay, we're going to make you feel a little bit better today. And whatever's going on, we're going to get you stabilized the best we can on this week, okay? Jokes aside now. And along the way, just communicate with me. You know sign language? And you're free at any point. If anything is too much for you, just say, just do this. Stop, and I'll stop. Deal? Cool. All right.
And relax. It doesn't hurt.
Left ear down.
You see?
That's it.
You see? Doesn't hurt.
A little bit more. I need you to let it drop. Down.
Just relax. Just relax your
Down.
muscle. That's about it.
That's it.
Just relax them.
That's it.
Because if you keep them too tight, they won't do the job.
Let's come over here, face down. Just squeeze my hand. There you go. Squeeze my hand. Just don't hurt me, please. Okay? Just squeeze. S5 hurt pretty bad, didn't it? Well, we have two options right now. I can do it here, I can do it here. This one will be a lot lighter on the table here. This one will set a lot deeper.
Whatever is better.
I mean, I think she's going to do better over here, but I have to be mindful for her as well.
Okay.
Okay?
Bella?
You tell me. This table, I'm going to get a deeper set. I can do it over here too. It'll be a lot lighter over here. This is going to give us less visits. This is going to take more visits.
Yep.
So
Bella?
give her a second. Let me call Shasha. Let's go face down over here, Isabel. Face down, leg forward. Wait, I didn't get a fist bump.
Uh-oh.
Thank you. Let me have Shasha come and hold her, or are you okay with that?
No.
Alright, Shasha,
Put your face down, Tatsika, so your back doesn't hurt.
you want to come and hold her, please?
Yes.
Alright, slide up. Alright, down a little bit. Down, down. So even feeling that this leg has more muscle, more girth. This is thinner.
Yep.
This is going back to nerve supply.
Yeah, well, the pressure goes to the left side versus the right.
No, I'm talking about nerve pressure from the sacrum and the low back. I'm not talking about using the muscle. So the girth here, this side is a lot thicker, okay? Now, let's go ahead and get started. All right, go ahead and hold her, please, Shasha. Relax the shoulders down. Bring your elbows out like that. There you go. And I'm gonna be down on S5. It's gonna be quick. And hold on, Shush. Gotta go forward. There. And we want to torque it.
Just relax that, okay?
Okay, so I'm on the right side, S5.
Just relax.
And we're
your
gonna
muscle.
torque up. Up. Let's raise this. There we go. Good job.
You see?
Good job.
That was it.
That's
That
the
doesn't
home
hurt.
run. That's the home run.
That doesn't hurt, you see? That's what I've been telling you.
And that's the worst of it. That's so beautiful. Okay, give it a second. Let's come up. Thanks, Shasha. Plant your feet down. Please.
That was it. Goddamn.
Huh? What'd you say? Goddamn? Nice! You said something! Goddamn. That was deep. Squeeze. Let's walk now. Come on. It's gonna be a little different.
It's gonna be a little easier to walk now.
Yes. Keep walking. A little different. A little easier. Have a seat over here. Let's continue. Sit up straight. That's the worst of it, okay? That's really the worst of it. Actually, it's set really good. I'm happy with that. Sit up straight. What I love about working with kids, they respond very quickly, okay?
It's
That's the
easier to
beauty. That's the
fix.
beauty of kids. The older we get, the more stories we get, the more trauma we get. Now, check this out. You remember that spine? Let's go up a little. That's 5. I'm not going to go so hard, okay? Do you remember that spina bifida S1 that hurt? It hurts a little less, I'm assuming now. Come back slowly. Good. S2. Is that a little different? Good. S3. Is that a little different? You want to come back as far as you can until it hurts? Good. S4. Can you come back as far as you can until it hurts? S5. A little better? Good stuff. It's moving now, Dad. Okay? That's where we're going to start there. I do want to work on your ankles. Let's go on your back. More tender on this side or on this side? Okay. I'm going to use the board. The sound is the board, not your ankle breaking, okay? I'm going to have you hear what it sounds like. Raise your left leg. It sounds like that. Relax the foot. Good. Oh. You're pushing. Just let me bring it. Can you bring the toes back? Bring it back, bring it back, bring it back. She's got an AS there. Okay. Come over here. Actually, it's fine. Let's get her through this part. Bring your toes back. Relax the foot. Down. There you go.
She hates that.
All good. Sit up and turn, and now you get a buff and polish. Now the fun part. This is vibration therapy. Is to break up any scar tissue, change the ligament patterns, get the blood flow going. And you don't have to tell me. You don't have to tell me if it's better. You just give me thumbs up or thumbs down. Is it a little different? Thumbs up, thumbs down. Okay. A little less pain when I was pushing. Thumbs up, thumbs down. You still don't want to be here? Thumbs up, you want to be here. Thumbs down, you want to go home. Yeah. Let's get through tomorrow and then we can decide, okay? Hi, Mama. Maria,
Hi.
welcome back.
Thank you.
Nice
So
to
cute.
see you. Hi. Welcome back. Good to see ya.
Oh my god, I'm
Guess who's back, guys? Daniela's back.
back! Me with back problems.
We took new x-rays, and on the new x-rays we show that the pelvis is a little bit off.
Yeah.
And it's been 3 years. We said number 1 was the pelvis is slightly rotated more. The pelvis is also down a little bit more on the left side. We can look at her x-ray. We have this ASEX pelvis on the left side. However, you used to have a 6 millimeter measured difference of the leg. It's 8. We need to get this up. I need to go do whatever I need to do to get it up in 2 days, okay? 2-3
Okay.
days. Fair enough? Okay. Now, we're looking at Coccyx. We're looking at Sacrum. Now, this is the other issue. Look at this here. And what we see here is this pubic bone on this left side is good. The right side is rotated out. And why that's important is this, because it's contributing 2 things. It's contributing, 1, to your short leg, because look, it's doing this.
Yes. And
Okay.
you can see it so clearly here, like this.
Yes, so it's tilting like this, but look, so whatever happened, now this is a PIIN, so the actual listing of the pelvis is down and in. So if I bring that up and out, what should it do to that? Make it a little bit better, right? So we have listings on both sides. We obviously have to find it on you, on the patient. But I'm going to see if I can work on that too with you while you're here, okay?
Okay.
Alrighty. C1, left side, 20 points. 5 points, T2, T3. Static palpation. The purpose of static palpation, we're looking for swelling, edema, point tenderness. As we start at the base, which at base of the neck is C7, you can see right there. And you can see that the dip, we lose it right there. 7, 1, 2, 3, 4, 5, 6, 7, 8. Her mid-back is compensation right now. We don't need to mess around with this. This is not the issue though. Es no problema. Problema aquí, this is a result. Yes. But mira, if I do this and we
So
bring this up, mira. You see? So this has to come up, this has to come down.
Do you think that's also why? Because if you look at my waist right here, like in front of me, you'll see that aside it's kind of more dented and the other one's more squarish.
Correct.
Okay.
Lo que estoy es
Sí,
justo acá,
mira.
inflado acá.
Mira, if you look here and here, right? This pelvis is higher.
Sí.
Okay? This pelvis is higher, this is a little bit lower. So if this comes like this, it becomes more even. Yeah?
Yeah, because one side is straight up just dented in and then the other one's just straight, like square.
Okay, let's work on the low. L5, S1, S2,
Okay.
S3, S4, S5, S3 more tender, S4 more tender.
Oh, I'm gonna be honest, all of them hurt.
Okay, S5,
No, that's okay.
uno más. This I'm going to adjust, okay?
Yes.
I'm going to bring this out.
Yeah, that kind of hurts.
Okay, this is Coccyx to S5. We have S3. Coccyx S5, S3, T3, C1. That's what I'm finding today. Now, I need to check the hip. Let's go on your back. Bring the leg up,
Oh my goodness.
over, around,
Ow, wow, that hurts.
over, around. Chest the other side. What?
That hurts a little bit.
Over. You hear that? Hold on.
Ugh.
Hold on.
Oh, wait. Oh, wow.
Okay. Ready?
Yeah.
Left knee.
Oh my
right
god,
knee.
that one hurts so bad.
Not so bad. Right ankle. Left isn't so bad. We have bilateral tibia. We have right ankle.
Oh my god.
Now the fun part.
Oh my god.
Okay.
At this point, let's just, I don't know, just do everything.
Okay.
Literally everything
Let's go on
hurts.
your tummy, please.
Okay.
When I do the right side, it's
Oh my
stuck
God,
right
yes,
there.
That
Yes?
hurts. Yes, that hurts.
Okay, so right pelvis, coccyx, pubic bone we're going to do tomorrow,
Okay.
T3 and atlas. Stand up for me, then we're going to tune up all your extremities, and the last thing we'll do is your jaw. We're going to do right side down for the coccyx, left side down for the pelvis, and then we'll do the rest. Okay, so for coccyx, we're going to be right there. I'm going to set it up to S5.
Football.
Gotcha. Home run.
Oh my god, you should really consider becoming a chiropractor.
Left side down. That was a home run.
That was
Like that?
a
PIIN. So the SI joint here, we're going to bring it up and out.
Okay.
Just like that.
Yeah.
Doo-doo. Hi. Hi. Wow. Gotcha.
Imagine I just pass out.
Stand up, let's walk it out. Keep going. So Mama, what I want you to notice, stop here. This, bring your belly button in and up. This is her posture. Mira. Aquí. Aquí.
Oh my god.
This over this. So practice this, bringing this in and up. Now, turn this way. Practice bringing it in and up. When she does that, the shoulders are over the butt, or the upper body is above the foundation. Now relax. And she slouches back. Okay?
Sí.
Good.
¿Entendiste?
Yeah.
Face down. T3.
Oh my god. I don't even move. The shocking experience of hearing that bone crack inside of your brain is a lot.
What does it hear like? What does it feel like?
It goes like it's loud. Are we doing my jaw?
Nope, we're doing your neck. Uncross
Okay.
the legs, please. Left atlas. Caramba.
Am I alive? Ow! Okay.
Now the fun. Sit up, sit
I'm
up,
so scared.
Sit up straight. Come on. Shoulder. Shoulder, shoulder.
Oh my god.
Shoulder. There you go.
my
Now,
God.
let's rescope
Incredible.
You?
Huh?
The
Oh my
new-
god, that neck
That's it.
The
situation.
new girl?
She's your new girl. Neck is clear.
Did you see
T3 is?
the amount of
Clear.
bones that sounded?
You had a lot of crunchy stuff going on today.
So
Mira.
crunchy vibes.
Mira, mama.
¿Ya?
Bueno.
¿Ya?
Ya.
Se
So rebirth.
se acomoda la cadera.
Wait, so
On your
oh my
back, let's do
God.
your knees.
Oh my god.
I have to work it.
We
Yeah.
get
I have
it.
to work the lateral capsule and meniscus. If I
Oh
don't
my
do
God.
this, it's gonna hold.
Respira.
4,
The happiest
3,
torture.
2, 1.
Oh my
Hold
God.
on to the table up top. Hold on. Right here. Hold on. Mama,
God.
hold her here.
Okay.
Fuerte.
Fuerte,
Yes.
fuerte. Uno momento.
Oh my god, I'm
no,
so
no,
scared.
No, 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 fuerte. Like this. Aquí.
¿Aquí? Ok.
Okay, like this.
Oh, so it doesn't lift?
Bueno.
Ok.
You got her?
Yeah.
Un poquito más. Bueno. Other side. Hi.
Hi.
¿Estás bien, mami?
I think so.
Go.
I love the purple gowns.
You like them? We
They're
got
so
we got
cute.
some new colors. Purple and blue. We're just trying to mix it up.
Respira.
Hello?
Ay, respira, respira.
Rápida.
I'm trying to.
Respira, respira.
Oh my god.
Respira,
Speed it,
respira.
speed it.
Oh my god. The way I have such a high pink
3,
color.
Oh, Rahim.
2, 1. Hold on to the table. You got her, mommy? Bueno? Perfecto.
Yeah. Let's
Sí.
just break it.
Mira,
Mami, ¿estás bien?
mira.
I think so, yes.
Sí.
I'm so okay.
Okay.
Hello?
Come on back over here, please.
What are you? I thought that was you. I was like, what is she?
Te estoy viendo para ver que la pierna esté.
All right.
Let's bring her up.
So brand new.
De
New skeleton.
You ready?
Yes. I love this. This is just.
No, I know.
I
Femur,
think. Okay.
talus. Slide over.
Like that.
More of the back.
Ow.
Femur,
Great.
talus. Turn to either side. I gotta do both. Can you take your socks off?
¿Qué?
Come on.
I'm scared.
Scared of what?
And for free? Hello?
For what?
And for free?
La da 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 da.
Ya.
La da 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 da. Ch da da da.
Oh my god. Hi.
Da da da. Da da
Oh my
da da da.
¿Ya?
Ja.
Hello? That was more than 5 fingers. I don't know.
On your back. Mira,
wow.
I'm just checking.
Okay.
This is left to right. This is right to left. It's a little bit there.
Are you sure?
I'm pushing harder.
That is.
Poquito. 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 Poquito.
That was a long-lasting nose job you gave me.
Chin down. That's it. Deep breath in and out. Slowly open. Left opens up first. Right compensates. So we're going to do the right side today. Open all the way.
Hold on, I think I need to breathe.
Okay.
Okay.
Open all the way. Open. Close halfway. Hold. Stop.
Oh my God, John.
I might cry.
Ah.
No, I feel it.
Aquí.
No, it's okay.
Okay.
Yeah.
You okay? 5, 4, 3, 2.
What in the manual are you doing?
I'm breaking up scar tissue. Watch. Open. Open. Close. Open. Close half. One more. Slowly. Open.
What?
Open
Open?
all the way. Open. Slowly close. That's it. One.
That felt like an hour.
Now the buff and polish. This is to also break up scar tissue. Okay, it's going to help a lot with the jaw.
Okay, so this is the real deal. When I would open my jaw before, I would do this, and I would have to like take a pause. Like I would go like this, and that would be a pause, and then I would be able to open it completely. And on the side, it felt so much like I would have to. It's like a step. I had to take like a step. And now, one step.
Awesome.
Amazing.
Squeeze. Lots of walking while you're here. Enjoy your time. Do lots of shopping.
Yes.
Spend lots of mama money.
Birthday money. Woo. Ow!
Birthday money. Who wants to see mama's happy birthday crack?
Me.
So
She's the dramatic queen.
Put it out there.
Uy, mami.
Why don't you ask your peeps if they want to see her get her birthday crack or not. Squeeze and squeeze. You're all set. Questions for today? We did a lot.
Oh my God. Okay, so do you think that for me to keep feeling this way, like light, and for the treatment to last a long time, do I have to come constantly?
Balance.
Yeah, just like a balance, exactly.
For balance, you need a little bit of care. Our issue that we're having right now with traveling patients is this. It's very simple. And I have a lot of them. I have a lot of them that come from overseas, or they just come from out of state or out of city. In her scenario, I would say at least once a year, twice a year,
Okay.
to come out for a little
Once a
bit.
year.
Once a year is fine, okay?
Okay, perfect.
You give me a few days, like you come in for 3 days once a year, you get your LA trip, you're good.
Perfect.
If we find somebody that can do the same work for you over there, fantastic. We're on a journey here.
I know.
Tell me, what's going on?
I want to talk to you about this also. So my headaches, I've been like fighting a headache.
What type of headache is it right now? Top of the head, tension headache, back of the head?
I think tension, but I'll feel it in here kinda.
Where's here, top?
Like right where.
The base of the skull?
Yeah, that
Okay.
occiput thing.
Okay.
Because when I'll rub it, it's like it relieves.
So
but
is
then
the
it-
occiput holding? Because I'm working on it quite a bit. We shouldn't have to work on it this much.
Yeah.
Is it holding or not?
Holding, what do you mean?
Is the adjustment holding, or are you still feeling the tension there?
It's
Straight up,
Most
yes
of
or
the
no?
time.
Most of the time it's holding. So what's
Yeah.
throwing it off?
probably my posture.
Okay.
I would say it's my posture's
Posture.
bad.
Because of activities, because of lounging, because of what? We're not trying to change our posture?
Yeah, lounging. I mean, it's like always been this way. Like I sleep on my stomach.
Well, hold on, stop. That's the,
I know.
That's a major answer.
I know.
I need to show you this. No, it's important. So stomach sleepers, why is this important? This is the spine. This is the back of the spine. Slide over a little bit. Unless you buy a bed that has a slit in it like this. If you're sleeping on your stomach, this is okay. That I don't mind. But which way do you turn your head?
It depends. Like I'll be like
Majority. Left?
probably left, yeah.
Okay, so let's turn to the left. What does it do? It twists the spine. And after 5 years of that, those
What's it
ligaments... Yeah.
Oh my god.
Look, if you're straight with the head down, it's fine. Look, if the head is turning, the spine turns all the way down to L1. So after a while, and then we compensate.
Oh, is that why my spine is like,
Look.
oh my god.
So then we get what? We get twisting and compensation.
Oh my
So
god.
this is not going to hold. I'm happy to see you every week if that's what you want. But that's not the fix, and that's not what I'm trying to do.
Well, so here's the thing.
You need to change your sleeping positions.
Yeah. What about side?
Side is okay. Now, because you curve to the right side, right? The high side of the rainbow is on the right. You want to be left side down.
Okay.
And you want to, watch, go on your left side.
Oh.
You want to put enough pillow so your head is level, left side down. You see how your head is level?
Yeah. I have like a smaller one like this.
And then check this out. You either bring the knees. So you need either a pillow or something
Oh.
between the knees. Why? So the pelvis stays and holds.
Oh, it's
Go,
okay.
go slide back a little bit. Watch this. Put your feet together. Look straight ahead. This is not an adjustment, by the way, but that's how you sleep.
Yeah.
Close your eyes and look that way. See how it feels. Feel how your back feels, okay? Now watch. Do this. Push a little. You see how your pelvis feels? Now watch.
Yeah.
Now you tell me what's different. So guys, when you have a pillow between your knees or spooning, significant others fine. Spooning and putting the knees together like this. Close your eyes, look straight ahead. Okay, you feel it? Feel how your back feels? Okay, now watch.
Yeah, like it feels like more pressure.
More pressure on the hips, correct?
Yeah.
Okay. Sit up for me, please. Are we clear?
Yes. Sorry.
Okay. So we're going to change the bed.
Big adjustment.
Yes. And it's going to take time. And
Yeah.
that's life. And you're going to do it. TMJ. Poppy, cracky,
Yeah. It'll be like
popping.
No, like a.
And it wasn't like that before?
I noticed it more now, but I don't know.
Could that be also why the occiput's not holding? Could that be part of the headaches? How about the tailbone? From our last, we changed it up. We did Coccyx and S4.
I think it's been good. I think it's been. I mean, I still feel it, but I think it's. Yeah, I think it's been good. I just can't sit on the hard ground, which I don't think you probably should, right?
Correct.
Yeah.
Correct. Okay.
Yeah.
So we have jaw, we have spine we'll deal with, tailbone, the foot.
Yeah. This gone. I mean, it's a little tiny bit. It's
More than
there.
50% better.
Yes, absolutely.
So the main issue today, number one, is the headache
Yes, headache.
with the occiput
Yeah.
and the jaw.
Mhm.
Tailbone is doing a little bit better. We still have work, and it's part of the, we have to do maintenance right now.
Right.
Okay? I gotta see if I can go deeper. If I can't, that's okay, we do maintenance.
Okay.
Fair enough?
One more thing. Sorry.
Please.
On like my back on the right side, I don't know if it's a muscle, but it's like it's been like this like pain, this kind of sharp pain, and I've just been like digging
here?
into it. Yeah, like around this area.
Let go. We'll take a look here, and that what you're actually feeling, that's a rib.
Oh wow, what?
I'll deal with that today, okay?
Okay.
I'll deal with that today. Starting at the base of the neck. Now, if the occiput's not holding, yes, it's not holding. We're going to check the right atlas and then come to the left occiput. T2 to 5 points, left side. So the sacrum, coccyx, we're still going to deal with, okay? And now what we want to check is what's going on with that atlas. And if that occiput's not holding, we know it's there on the left. Yes?
Yeah.
But we need to go there right now.
Oh. Ooh.
Okay?
Ooh, yeah.
So we have a whole different combo. 7, 1,
Sit up straight. 4, 5, 6, 7, 8. 5. 5, S4, Coccyx, Atlas, Occiput, then we'll check TMJ and foot,
Awesome.
shoulders. Okay?
Hell yeah.
You ready?
Yeah.
Let's do this.
I did.
We're gonna do left side down for the Coccyx, S4 on the other side. So let's go here.
Ooh. Ooh, yeah, that was all up there.
Go right side down.
Thanks.
This side over here.
Oh,
A little more.
I'd say so. Oh.
That's it. Sit up for me, please. Let's walk it off. So, if there's more than one, I have homework for you. Your dimples are moving way better, by the way.
Yeah. It's
Yeah.
kind of, this part kind of hurts.
Keep
Maybe that's
walking.
like what I don't know.
Walk it up. Shifting around. Is that getting easier on the side right now as you're walking?
Yeah. Yeah, definitely, actually.
Keep walking. T5.
Oh my god. Oh, I needed that.
Home run.
Oh my god.
Slide up. A little more.
Oh.
A little more.
Oh.
There we go. But the process took a moment.
I needed that.
The actual forgiving and all of that doing takes a moment.
Yeah.
It took 7 years to let go of the ego for me. How long is it gonna take you? Let's have a seat.
Probably longer.
Shouldn't have to.
Yeah.
Sit back for me, please.
But Eckhart Tolle was saying that women are closer to, which, you know,
Closer to what?
closer to, why am I thinking of enlightenment? Kinda, right? Like what is the word I'm looking for? Like being now, the now?
They're closer to the now, yes.
Yeah,
They can get into the now faster.
yeah.
They can get more in tune into the now. If you're in the now, you're not thinking of past or future. And if you're in the now, you'll be able to forgive.
Right, like it's not even a question at
Right
that
here.
point.
Occiput.
Well, I felt that one on my jaw.
That one?
Yeah, I was like, it's like
Can
right
we,
in
can
there.
we check something? Open. Close. Open slow. Okay. Let's do the occiput. There we go. Gotcha.
Oh my god.
Now that's the home run.
Yeah.
Walk it out. Walk it out. Walk it out. Good.
Oh my, that's like all in here.
How's the head?
It's good.
Right? So we're getting some answers in this process, and again, I'm already giving you some answers, and the biggest thing today was, besides the letting go, is the sleep position, okay?
Yeah. Okay.
Let's run the meter on the spine, let's see how the spine's doing, then we'll continue.
I can't. So that's for sure the bed that did that, like me sleeping like that?
Sleeping face down.
Wow.
That will not allow this stuff to hold, by the way. Now,
Oh, that curve?
the curve, but more important, is sleeping on your stomach. That's stomach
Oh.
sleeping. Besides all the other stuff.
Yeah.
So,
Oh, yeah, because I don't know where my head is. Like when I try to sleep.
try to figure that out in the next few weeks, okay?
Yeah.
Check this out. Back slowly. Right on. Good?
Hell yeah.
Good? T5 cleared up the rib, by the way.
Like, what was wrong with the rib?
T5 was rotating and it was pushing on the rib.
Oh.
And the question is, I know someone's gonna have, because we like to teach people here, right? We like to teach on with these videos. Part of it is teaching. So this is the spine. You see, this is the thoracic spine. It has those extra little bumps inside there. Those are called demifacets. But what they are, you see, these don't have it. You see, they start here and the end here. Those don't have it, do they? See those little notches? That's where the ribs sit. So these little notches here, that's where the rib sits. And when the vertebrae rotates, it pushes the rib pushes it out a little bit. And that muscle knot you were feeling was from the rotation of the rib pushing there. And by setting the bone forward, it changed the position of the rib.
Wow.
So this,
I just moved you just moved my rib like that?
I just moved your rib like that. For your good.
It's rough.
That's cool, right? That's that cool stuff. Now the fun part. Open, close halfway, hold, pushing EX. Good, much better. Good, much better. Slowly open. Open, all the way. Close halfway. Hold. Good. You got it, you got it. Open all the way. You're good, you're doing much better today. Open. Close. I got you. You got it. You got it. Yeah, that's it. That's it. That wasn't so bad.
Yeah.
On your back, please. Now, let's look at the ankles. Bring them back towards, yep. Relax there. Not as bad as before. Let's do the lotion.
And like, okay.
It's there, but it's not as bad.
Yeah.
That's okay, right?
Yes.
That's not bad. 5, 4.
It like
3.
tickle hurts.
It's good. She's not yelling today.
Yeah.
5, 4, 3, 2, 1. Good.
Oh.
Good.
Oh.
3, 2.
Oh my Lord. Woo.
Okay. Let's see.
Do it today.
What's that?
I feel it. I think
It's
we're gonna
happening.
do it.
Come on, we gotta do it.
Hopefully.
We gotta do it. Gotta go. You know, you gotta make me work, don't you? You gotta make me work.
One day.
One day it's gonna happen. Slide up. Let's set the ankle. Talus, which is the ankle bone. Heel, fibula. Tune up the other side. Turn to your side, please. Relax the ankle. Let it go. Other side, please. Let's go on your stomach, please. Now you see the difference. Look, you're on your stomach, your face goes down. Check it out. Spine is straight, right?
Mm-hmm.
Mm-hmm.
Uncomfortable though. Oh!
That's coming off the second.
Ooh.
Let it go. Now the fun one.
Oh!
Come on, stop fighting me. More on the right, more on the left.
Oh, more on the right.
All right, posterior tibia. Hold on there, please. Relax there.
Ooh.
Relax there. A little more. You good?
Yeah.
There, gotcha. Check it out.
Whoa.
Go in your back. And let's do a posterior fibula. One more. There you go. Let it go. Come on. Let it go. I had a case like this, and something came to me. It didn't show up. I'm going to test it on you. This lady, she came from Fresno. It's a nurse. There were some videos with her. I didn't video this part of it, and her right ankle wasn't releasing. And I found something else in her spine, and we set it and it actually released. Just turn on. I'm just curious. Just humor me for a second. Sit and just turn. Just humor me for a second, okay? Let's check it out. Sit up straight. Number 4. So, check it out. This is 5. Okay?
Uh-huh.
This is the one I'm thinking.
Ooh! That one's tough. Ah!
Right? Okay. Bear with me, okay?
Okay.
Let's go on the knee chest table.
Oh,
I
this
did
one.
the same thing. It was so interesting because we have a couple of videos with her. It was the one day we didn't video this, and it was tibialis anterior. It's just not releasing. I'm working the crap out of it,
Yeah.
and it's just not releasing. It's been over 4 visits for sure. So what I need to do now is see if we can release it another way. Bear with me, okay? You got this. Tell me down. 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 Gotcha.
Oh my god.
Yeah, that's it. That's it. Gotcha. I had to, okay? Come up slowly.
Like,
Something came out. Came up, right? Boot.
it felt like coldness. It's really weird.
That's that coldness you're holding in there. L4.
A walk? Okay.
Crazy, right? Did I hurt you? It stung a little
No,
bit, but that what you're right now what you're releasing is not.
Yeah, that wasn't like really. I mean, yeah, it wasn't really.
It bit a little bit.
Yeah.
It was spicy.
But it wasn't like the whole thing.
But that's not what you're letting out right now, right?
Yeah, I don't think so.
Go on your back.
If this works.
If you gotta let it go though for me. If you're holding, we got a little bit.
Uh-huh.
We got a little bit.
Oh.
That's it.
Oh, it did it?
We got a little bit. I'll
Oh,
take
wow.
it. Walk, check it out now.
Oh.
I'll take it. Tell us.
This is like smoother.
A little different, right? What in the toes? The test is on your heels though. Walk on your heels. Because that's the movement bringing it up. Easier on the right side?
Yeah, actually, yeah, like this still feels hard, but the right one.
Have a seat. And let's make sure. That's crazy.
Right? Next time, we'll get the full thing.
I hope so. All clear. Shoulders.
Whew.
Don't help. Don't help. That's it. Years. Okay, forget it.
Yeah. Just had a mini panic attack.
Questions for today?
No.
We did more today.
Yeah, we did. We did a lot.
Yeah, it's good. It's good. L4 released more.
Yeah, that was like. I
Out of
haven't
everything.
felt that one.
Mm.
Yeah. Whew.
Relax there. Questions? No more questions. What you doing here?
Well, I'm so excited to be here, number one.
Thank you.
I have a lot of issues going on. One being my nose.
Okay, what's up with your nose?
I can't breathe properly. It's
Right
hard.
side, left side, both sides.
I feel like it's the right side, but it switches sometimes.
How about taking in the breath when you can? Like, can you get a
I can, but it's like difficult.
just at the nose? How about the lungs?
The lungs too.
Okay, that's what I
Yeah.
thought. What else?
Have some issues going on in my neck. I can feel just some pain and some discomfort at times, and also my back because I have such large breasts.
Okay.
It's always an issue, my mid back and then my low back as well because it's so curvy.
Number 1 is the nose. Number 2 is the neck. Number 3 is the back, low back.
Yes.
Any radiating shooting pains down the leg? Any foot, knee issues,
Oh
ankles?
yeah.
Because we were taking
definitely.
X-rays upstairs and you were complaining of your knees.
Yeah.
Was that from what?
I feel like there's a hip, knee, ankle, and toe issue.
It's all connected.
Yes.
Can I ask a very serious question?
Yeah.
Why here, why now?
Why here, why now? You know, I'm getting older. I'm in my 30s. I'm getting older, and I want to.
Because it's not easy coming here.
No,
I get it.
It's not.
So why now?
Well, I feel like fate led me to you. I feel like
Interesting.
because I don't trust. I don't want to go to just anybody, and I feel like. I don't know. I'm just feeling like you could just. I don't know. I'm feeling really great energy from you, and I feel
Okay.
like, from what I've seen, you know how to get the job done.
Okay.
And I feel like right now is a good time because I just want to. I'm in pain, and I don't want to be in pain when I have to make someone else feel good and massage them.
Correct.
I don't want to be in pain.
I feel you.
And
Yes.
I'm also a professional dancer. I can't do my job properly
Got it.
if my body is not working.
So here's what we're going to do. We're going to go over your x-rays.
Okay.
I'm going to explain what I see. Watch you walk.
Okay.
Do our exam. And figure out where we're going to start.
Nice.
Let's look at her posture. Let's look at the overall appearance. Now, this is our posture line. When we're running the posture line, it goes through the center of the lowest lumbar.
Okay.
This should be going through the neck right there.
Wow.
It should be going right here. So it's that far off on the x-ray. And what that's telling us is you carry your upper body behind your foundation. Now, here's what's interesting. You're saying you're heavy chested. I'm using your words, right?
Yeah.
Okay. So here's what's interesting. It's actually helping your spine right now.
What?
It's not hurt in your situation at the current moment. It's actually helping the spine because it's bringing you forward. If not, you'd be even further back. That's what's interesting in your case right off the bat. This is you right here, right? You see that?
Yeah.
So it's bringing you slightly forward. The issue we need to see is, and I kind of see what's going on here, is as we start to bring the spine forward, then it's really going to bother you. Then we got to make some other decisions.
Right.
Okay?
Of course.
You got it?
I got you.
But right now, it's helping your spine. We have a rotated pelvis and a rotated sacrum.
Oh, Lord.
The good news is your hips are pretty much level. That's the great news. So
Okay.
your base is level, but
Okay.
here's what's happening. I'll reference the right side. So your right side goes down and turns in. Your sacrum on the right side goes back right. The overall effect is your body wants to go to the right side, ma'am. You favor walking to the right.
I do?
However, you have the tailbone, whatever happened, it rotated back and it's slightly down on the left. So it's dropped a little on the left. So I'm pretty sure when you walk, it's a little bit off in a wiggle.
Yeah.
A little bit of a wiggle going
Yeah.
on. But here's what I want you to see. It's rotated right. It's going back on the right. The right pelvis goes down and turns in. The fact that it's down and in tells me there was a trauma. You had a couple of traumas in your pelvis and your low back. I know that. Okay, let's continue. The way the shape of the joint works, normally when it goes down, it wants to go down and out. It wants to go down and out.
Okay.
Up and in, down and out.
Yeah.
Your left, it's the opposite. And I don't know which one we're going to adjust till we examine you. Left side goes up and out. Sacrum goes back on the right. You see, so it's favoring the right side.
Wow.
But because the sacrum is dropped a little bit on the left, it wants to come back. So we got a little bit of that wiggle when we walk. Okay. As we go up the spine, the body compensates, wants to come back to neutral, but then it curves again here, it curves again here. All this is compensation to your foundation. Now, as we go up, jaw looks decent. Looks a slight deviation on the right, but a little decent.
Okay. Then.
I do see you have a little bit of a critical atlas, and that's going to contribute to your breathing. Your C2 wedges on the left side, your atlas wedges on the right. You can see this capsule of C1 here. It's thicker than on this side here.
Yeah.
So we have some swelling and irritation on this right side. But if I find an upper cervical on the right, I have to set C2 first to give it a better foundation to sit on.
Okay.
So here I'm seeing a C1, C2. We have a little bend in the nasal or in the septum up top. No problem. We have the foundation we need to deal with, and I'm just checking through here. Now the good news is I don't have any side slits, I don't have any blunt traumas going through here. That's the good news.
Yes.
But what I want you to notice is this: they're tilting, right? They should be level and parallel like that one.
Got you.
Okay? And where it's coming from, let's zoom in over here. You got a bent tailbone coccyx here. You have an S1 sacrum issue. So the rotated sacrum is an issue. Okay? Just keep walking. Slow it down just a little bit. Just a little bit. Watch the feet. So you can see that the right foot flares out, but you can walk a little bit. Just whatever's your normal.
Okay.
Okay, whatever's your normal. So that right foot flares out. She swings it a little bit because of the drop sacrum on the left side. She swings that right a little bit. She's pronating that left. You
I am pronating the
You're
left.
pronating. Yeah. So you swing that right is what happens, and you pronate the left to compensate. And she kind of just walks side to side when you walk, okay? So you kind of just go side to side like this. And it's not this. It's not this. It's the foundation.
Wow.
Okay? If you want to turn around and just test something out for me, can you hold them up?
Yep.
Hold them up and go ahead and walk holding them just so we can rule that out, okay?
Right, okay.
Go ahead and walk. Now you can see it more. She drops on the left and wants to go right. Every time you want to go right, it drops on the left. There you go. Now you can see it better. Okay. Normal walk. Have a seat over here. Let's get started. Oh, there it is. 25 points. Left side C2. 30 points. And that's where my meter only goes to 25. There. It's starting to balance out. 20, 18 points, 20 points. Left C2. Alright, so we have critical atlas up top, T6, T7, left side, sacrum. We're down in the low. 10 points. We're down low, S3, S4. Static palpation. As soon as we get here, that's where your inflammation is.
Yeah.
That's it. It's not as much here as here.
Mm-hmm.
More tender. The top one is tender.
Yeah.
The bottom one.
Yeah.
More here or more there.
Oh, there.
Not as bad there.
Right.
Little bit there.
Yeah.
Definitely there.
Definitely, yep.
Head down, please. 7. 1, 2, 5, 6, 7. Let's continue down. Let's check down low. Let's check the pelvis. Slide forward, please. Open and close the knees. There you go. Right side only, please. When she does the right, the left wants to go with it. Left side only. You see that? When you do the left, though, the right also wants to go with it. Go right again.
This is more tailbone issue. Both are stuck, but tailbone is more stuck. We'll deal with the pelvis later. Let's check low back now. Back slowly towards me. That's 5. That's 1. That's 2. That's 3. Starts there. 3. I'm going down still, okay? 4. 3. No, 3 is good. 4 more tender. Right there. Yes? That's 4. Now let's look at 5. Not too bad at 5.
No.
S4, T7, let's check the next. 7, 6, 5, 4, 3, that's 2. That's 2. That's 1, it's 2. C2, you feel that now? C2, T7, and S4. We're going to start there first. We're going to clear the spine,
Okay.
then we're going to check the nose.
Okay.
Okay? I don't want to, I'll put gloves on and then we'll deal with the nose. And we'll also start on your ankles today.
Okay.
You ready to get started?
Yes.
Questions?
Nope.
Showtime.
Okay.
S4 with a little twist. Alright. Good. 1, 2, 4. There we go. Gonna come down. They're gonna go out, okay?
Okay.
No, I'm telling Shasha. That's just prep. And we gotta torque it up. And she don't fight. Ah, that's a piece. There you go. Thank you, Shasha. Thank you. 7, T7. Hold on. Nice. Good. My hand is right here for you.
That was intense. I liked it.
Walk it up.
Whew.
Walk,
Wow.
walk a few times, please, back and forth. Set good.
Good.
One more time.
Yes.
Now let's set, and then we'll set C2. C2. Do 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 do. Do 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 do. Gotta set it up. That's the home run.
Amazing.
Watch, there's a breathing point right here. Check this out. Sit up for me. It might be spicy for a second.
Okay.
It's the lung point. Go ahead and deep breath in. I haven't touched your nose yet. Take a deep breath in.
Wow.
Different?
What?
No. I know it's spicy. Tell me
That's
which
good.
side is spicier. Which one's spicier?
Ooh.
Right or left?
Ooh, I can't tell. I feel like
Both.
Yeah, I'm like.
Deep breath in.
Yee.
Deep.
Whew. Wow.
Mm. Walk it off, and then we're going to do your nose. As you're walking, just from what we adjusted, tell me if anything is different so far.
I feel like my back is like straightened. I feel feels a little bit lighter even. Wow. I definitely can feel something in there. It's
Deep breath
aligned.
in. Deep breath in. Okay, let's go over here on your back now. So you were complaining of the right nostril.
Yes.
Okay, but we're going to now check which part of the septum is bothering you.
This is exciting.
Now, this is the nasal bone, okay? This is the cartilage there. This is the right side, this is the left side. I agree with you, it's there.
Do it.
This side is okay. It's not sharp when I do that.
Right.
But when I do that side,
Oh, wow.
it's stuck right there.
Yeah.
Okay.
Wow.
Let's do it. Now, she actually got a small nose there for me to grab.
I did.
Breathe through your mouth, okay? Chin down. That's a little bit. There you go. Still more. There you go. But I'm going to show you another connection. Watch this.
Oh,
We're going to follow it over here to that jaw. Open the jaw. Open. Yeah, right there. This is part of the breathing. Okay, close. Slowly open. Open. Left deviates, right compensates. We need to deal with your jaw now.
oh wow.
One of your homeworks is going to be steaming starting tonight.
Oh
okay?
yes.
Steaming, please.
Okay.
Step
I
up.
love good steam.
That way you can drain.
Wow.
Different?
Already.
Tell
Wow.
her.
I could.
Tell them.
Oh my god.
Tell them. They don't believe it's a real thing.
Oh my gosh. I have air going up my nostril.
They don't believe it's a real thing. It's a
Oh
real
my God.
thing. And you'll report back after tour that what happened.
Oh my gosh.
Come on back.
I can actually, I feel like air is going through the entire,
Right side.
oh my god. Wow. What? Oh my gosh. Oh,
Here's tissue.
wow. Thank you.
There you go, man.
Woo-wee. Okay.
Yes, ma'am. Now we got to deal with your TMJ, okay?
Okay.
You saw why, though.
Yes.
Sit back for me, please. Look up. Slowly open. Open. Left compensates. Right. Sorry. Left opens up first. Right is the compensation. We're going to deal with the right side. We're going to
Okay.
be applying lateral to medial pressure on the
Okay.
right TMJ. Open
Okay.
all the way. Close halfway. If anything is too much, you tell me to just raise your hand, okay?
Okay.
Open all the way. Close half. Hold there. There you go.
Oh. Oh my god.
There's a ganglion of cell bodies that sits behind there. It
Yeah.
can also produce pressure and affect a lot of the sinuses and a lot of the glands in the face.
Oh wow.
Open. Pen.
What?
Pen.
I felt that.
Open. Different.
Oh my gosh. What?
Different.
Woo.
Now, keep breathing. Deep breathing.
Oh,
Watch.
I can actually breathe.
Watch. Deep. Out. One more. Deep.
Whoa.
Out.
Mm.
There you
Ooh, yeah.
go. Left side. That's it. S1. S2. S3. This is the one I did. Tender. Better.
Yeah, yes.
Yes, what?
I agree with you.
We'll need to deal with 5 next visit, okay?
Okay.
We can't do sacrum and 5 on PDA the same.
Gotcha.
I've done it in some cases sideways, but your table is going to be there right now.
Okay.
What I'm doing is I'm using Gonstead contact points, adjustments, using the board to absorb the shock. It absorbs, it allows me to go a lot quicker,
Okay.
a lot more high velocity,
Okay.
less pain to the patient.
Okay.
Okay? Relax the foot,
Okay, relax. Woo.
relax the foot, ankle.
Wow.
Okay? Raise it up,
Okay.
raise it up. Fibula. Raise it up. I'm on the back side of the fibula. Setting.
Wow.
Come on up, walk it off last time.
Wow.
And then I gotta give you the buff and polish.
The buff and buff.
Now you can tell us what's different with everything overall.
That's insane. Cause I feel,
What?
I don't know, I feel like My right foot is going straight now versus it was going out. I don't know. Like,
Sure. I'm not gonna say nothing.
I can feel it. I can feel it. I feel like before I was kind of walking to kind of like out. And I don't know, I feel different.
Turn around and hold them up.
Okay.
Okay, you can put them down.
Okay.
Good stuff. Have a seat. Let's buff and polish you out.
Polish. Okay. Ooh. Oh my gosh.
Stand
I just
up.
have an hour of that now. That was
Stand up
amazing.
for me, please. Squeeze that
Okay.
one. Squeeze. Face me, please.
Okay.
Squeeze. Good. Squeeze. Nice. Relax that
I
one.
don't know why I just jumped up like that.
You got up fast.
I did.
She
Oh.
got a little spring in her step now. That was interesting.
I know. I'm like, why did I do that?
I have no idea. Do you normally do that?
No. Oh. Yeah.
Squeeze. There you go.
Oh.
Now you're gonna be able to do your job better.
Amen. Thank you so much.
You're welcome. Welcome to the office.
Thank you.